Welcome to Tame the Taboo. This podcast is brought to you by Discover Her Health. Discover Her Health specializes in healthcare, education, and resources for her most intimate concerns. I'm your host, Nurse Jenna Ray. I'm a women's health and gender-related nurse practitioner, and I am making it my business to take you from sufferer to sensei. So if you are suffering from conditions that are not easily treated in an annual exam, or you want to join me on this journey to become my healthiest, wealthiest, best business owning self, sit back, relax, and enjoy these episodes. Okay, welcome back to the podcast. I am excited today. We have an author. Laura Zam is joining us. And so Laura is not only an author, but she's an award-winning writer. She's a TEDx speaker, a playwright, and a sexual solutions expert. And so her work has been featured in many media outlets, including NBC, The Washington Post, InStyle, and numerous others. And she is the author of The Pleasure Plan, which is a best-selling memoir about sexual healing being adapted into a television series. And so I'm just excited to have you, Laura. We actually met at a networking event formally. We've kind of followed each other on social media, but formally met at a networking event for the International Society for the Study of Women's Sexual Health, which we lovingly call ISHWISH. And it is just so good to know that as a clinician, as a provider, we are not alone in the fight. And there are authors and playwrights who are joining us and kind of taking up the task of revolutionizing women's healthcare. So welcome to Tame the Taboo.
Oh, I'm so thrilled to be here, Jenna.
Yes. Okay, so I know I did that lovely intro, but tell me a little bit more about yourself, because this is a conversation for us to get to know each other and of course for, us to introduce each other to each other's audiences.
Yeah, sure. So I started out as a writer, and I wrote a one-person play about my journey trying to heal from 6 different kinds of sexual dysfunction associated with childhood trauma. And in the middle of my journey, finding how difficult it was to get good information, to get practitioners, mental health providers, medical providers, even friends talking to me honestly and knowledgeably about women's sexual health, especially women's sexual healing, trying to respond to different kinds of problems. I found that it was so difficult that in the middle of this process, I decided to become a sexuality educator so that I could learn everything there was to know so I could heal myself. And then I could help other people, that I could provide a place through courses, through my writing, through different media, to just be a place where people could come and ask questions and get very, very clear information, detailed information about women's sexual health, especially when things are problematic, as I said. So now I am thrilled to be able to work as a sexual healing coach. And I'm a teacher. I run courses on women's sexual health and healing. I write articles and essays and do a lot of public speaking. I work on college campuses doing assault prevention, but really it's under the umbrella of women's sexual health and empowerment. Mm-hmm. And I get to do all of that, and that makes me so happy.
Yes. And your happiness has turned you into a force really to be reckoned with. I love it. I talk a lot about how I'm on a mission to revolutionize women's healthcare. And the more I say it out loud, the more I convince myself and I convince my listeners that it's actually a possibility for us to really turn this thing on its head. Because when you really get into it, it's like it just takes a few people working in different spaces to demand better. So it's going to take clinicians and authors and playwrights and educators and patient advocates and allies coming together to say something really has got to shake. We've really got to do something different in this space.
Something has to change. And actually a huge part of my mission is just empowering patients to demand more. I think that there's a critical mass. If we just encourage people that we come into contact with and say, hey, you don't have to settle for that. Mm-hmm. You can ask questions. You can demand if you've got pelvic pain, you can demand a session where you just can talk to your doctor, and your doctor doesn't have a speculum all up in there and you can't get your words out because things are really painful, right? You can say, no, I want to explain this to you, and I want to just do that, and I want you to hear everything that I have to say and all my questions, and I'm paying you to provide me with guidance. And if you can't get it from your doctor, you're allowed to look for another doctor, to ask for a referral to a pelvic floor physical therapist or a specialist.
To shop around.
Shop around. It's just,
Yeah.
I think that empowerment piece is so critical. And you raised such a great point that this is a revolution, but we're working together.
Mm-hmm.
We are working together to do this. Yeah.
Yeah. And I love the part that you said about like promoting healing, because health in the way that clinicians are taught is all about like disease management. Not all clinicians, especially not necessarily nursing, but definitely the medical model is, here's a disease, here is how I fix it with surgery or with medication. And healing is a little bit different than just cutting out something surgically or giving out a medication, right? So let's dig a little bit deeper into like what it looks like to not just be healthy, but to also be healed.
Right. Well, when it comes to sexuality, there's a lot of component parts that go into healing, because this state of needing healing can be deeply entwined with our relationships, with maybe a dissatisfaction in the relationship or something missing in the relationship, something that has never been able to be communicated. So there can be a relationship component to that healing. There's definitely, most of the time in my experience, there's a kind of like erotic rewiring, or maybe wiring for the first time, because many people like me, for instance, who never had a healthy relationship with my sexuality, didn't have the infrastructure, the neurological infrastructure for pleasure, for just knowing what was going on, for having an idea of pain, and pain management. I had none of that. And so I built that from scratch. Many people did have that. They used to have, let's say, hot sex, and now they don't. And they're looking for something that they had in the past, but now the weeds have grown over, right? That meadow. And so there is, the healing process can be very much tied in with one's psyche, with one's emotions, with one's just ability to feel and give ourselves permission to feel pleasure. So yeah, there's a lot of component parts, and that's the work that I do. I'm not a medical provider. I can point people in the direction, say, hey, could be a good idea to get a referral here. It sounds like you're not getting a lot of information, let's say, from your regular old gynecologist. So I can point people in the direction of maybe looking for or looking at different kinds of providers. But my purview really is helping people with that erotic infrastructure, helping people to reclaim pleasure or understand pleasure or claim it for the first time.
I love that. And I think we also have to recognize that when we have been radically, I don't want to use the word broken, but harmed, right?
Yes.
Because of sexual trauma or because of pain, then it's not going to just take a little bit of pleasure to get you to the next level, right?
Right.
That radical pain is going to have to, it needs radical pleasure in order to elevate you and have you be fully healed. So it's not just about becoming pain-free. It's about, how do I thrive and how do I rewire my brain to be accepting of pleasure? And you only do that by feeding it tons and tons and tons of pleasurable experiences.
Oh, yes, exactly, Jenna. And also I would only add, because so beautiful the way you said that, I would only add, it takes radical empowerment, and that people need They need guides in that department because society is not handing that to us. Society is afraid of women's sexuality. It's dismissive of women's sexuality. It's saying, oh, well, you can just accept things the way that they are. If you're with a male partner, it's drummed into us from a very young age that your partner's pleasure is paramount, that your partner's pleasure is everything. Mm-hmm. And your pleasure really is minuscule in terms of its importance. And that if your partner, for instance, doesn't have an ejaculation, the sky is gonna
Mm-hmm.
fall. Mm-hmm. Or your partner's gonna have to go to the hospital. That's what it is, this kind of implication I find my life, but also other people I talk to, from the early days of, fooling around in our teen years, and if you're with a male partner saying, I have an erection, I'm going to get blue balls. Mm-hmm. I'm going to get blue balls. I was like, what the heck is blue balls? Mm-hmm. It turns out blue balls is just this myth, right? That there's going to be an explode. This person's going to explode.
If he's not satisfied. I think we need the equivalent for women. We need pink lips or something. We need something that says if we do not deliver the pleasure that a woman's body needs, then she will be in some way harmed. And so therefore pleasure is a form of harm reduction. So
I love that.
Maybe this is the birth of, I don't know, instead of blue balls, we got pink lips.
Pink lips. I love it.
Because every woman deserves to be completely satisfied. And especially when we reframe it and we think about pleasure as a tool for healing and we recognize that it is so essential. I can do all the work in the world with my clients. We can give them hormones, we can do injections, we can do laser therapy. But if they don't have the positive feedback, the pleasurable experiences, their desire is still never going to rebound. They still, physically nothing's wrong, but now you still don't want to have sex because you have not fed yourself the pleasure that you deserve to kind of, like you said, rewire our brains to be accepting of pleasure, right?
That's right. And also I really want to, in my courses, I teach a whole radical, love the word radical here, a radical reframing of sex itself. Because I think often this quote unquote low libido is a rejection of something, I put it this way, like something that's offered to us at 10 p.m. after a long day, and
that doesn't even look good. It's not presented in a pleasure. Come on, at least put a cherry on top,
And it's never been great because it's on somebody else's terms. It's somebody else's pleasure. That's really the central, right? The central part of this. And so when that comes at us, so to speak, after a long and a busy day and we are just exhausted, it's so unappetizing. But the analogy that I use is just, it's when we look at this outside of a sexual context and there's something that we find pleasurable, there's not any kind of complexity around it. I love chocolate, dark chocolate. So I don't have to think about it. I don't have low chocolate, It's my body moves toward it. Mm-hmm. Something that I'm not interested in, my body moves away from. It's just an organic process. It's an animal process. It's just the way that we're wired. It's a psychological process, the pleasure principle, Freud's pleasure principle. So we're going to do that. And if we can kind of tweak sex so that we understand that if we're not moving towards something in a very organic and natural way, there needs to be a tweak of the sex itself to make it so that it is something that we want. And sometimes that means to switch up the activities. I find with a lot of my clients, when they say I have low libido, what they really are rejecting is intercourse as the only means of making love. And often they feel like this is going to be way too involved for me. And so I'm going to shut down let's say in the moment, when it's presented, like let's say partners, aroused or horny, and right, it's presented to them, and the only option is intercourse in a heterosexual context. Of course, that's not the only context, but I'll just use that as an example. They're rejecting this intercourse on my husband's, let's say, terms, right? And so they're shutting down sexuality. They're shutting down a connection to their erotic selves because that one thing that is on the menu is the only thing they think that can ever be offered to them. And I find that with my clients, when we just say, hey, anything can be on that menu. Maybe intercourse is not what you want sometimes, right? Or even often, but maybe what you want is a massage. Maybe you want it, you want to use your vibrator and have your partner just stroke you or something. Maybe there's something else that might bring out that natural organic yes. Like, oh, this could be exciting, especially after a long day. That transition is difficult. But if there's something enticing, if there's no pressure involved, and I find that, then people can say, oh, well, if it's on my own terms, well, what do I want out of relaxation, out of feeling good, out of transitioning from this being in my head or being so busy or stressed all day or being a caretaker? What would feel good for me? Now it's a conversation. And even if partners say once penetration, there's now at least some sort of a compromise or a composite here of different activities. Okay, something that you would really enjoy right now and something that I would really enjoy and am looking forward to. It's not just what you want.
And I think given the example of like heterosexual penis and vagina intercourse, we also do a disservice to that man too, because he might enjoy bringing joy to his partner, but he's never actually experienced it, right?
Right.
Because he has not been taught to center her and to listen to her. He's only been taught that it's this wham, bam, thank you, ma'am, penis and vagina act exchange. And so there is a disservice that we have to acknowledge too for the men, right?
Oh,
like,
yeah.
Let's elevate his play. Let's elevate his definition and his appetite so that he's more, if penis and vagina is intercourse is the steak on the menu, he can be like, okay, I don't want steak tonight. I want something else, right? And so every human being deserves to have those types of options.
Absolutely. Have their options, expand their repertoire, be able to take some of the pressure off, because often I find with partners often or can be resistant to change in the bedroom. But I find most of the time they're resistant to change because what they're really frightened of is incompetence and humiliation. And so they're staying within the lines because they feel that if they color outside those lines, or they're asked to try coloring outside the lines and they don't know how to do that, they fear this rejection, this humiliation. So it's but once they can be guided and supported and expanding in that way, I totally agree. It only enhances their sexuality. What happened with my husband and I was we spent a long time in the journey that's documented in my book, focused on my sexual healing. But at some point, my husband's like, wait, what about my sexual healing? I've got my own stuff. I've got my own history of, different things that have happened, rejection,
and
let's say. And
intertwined with you and your story.
That's right.
So your trauma is not just yours when you're in a relationship and you're sharing these experiences. It can be very traumatizing for someone to have sex with a partner who is having pain, right?
Oh, yes.
And so many of my clients are like, I just have to get myself drunk and my husband's refusing to have intercourse with me anymore because he doesn't want me to just lay there and take it. That is going to impact both parties. One, you are literally drinking yourself into a stupor to be able to tolerate something. And then your partner is feeling like he has to abuse you in order to get something that maybe he does or does not even want to begin with.
Yeah. And I mean, that's why, your work is so critical, so important in this world, because there's so many options. Like when we're talking about pelvic pain, there's so many treatment options. And you really do need a proper diagnosis because lots of different things can cause painful sex.
Mm-hmm.
And most people haven't found their way yet to write to a practitioner or a series of practitioners who can really get to the bottom of things, so to speak.
Literally.
Yes,
Yeah.
and really get those solutions, because once those solutions are found, to me, that's where the empowerment really takes off.
Yeah, that's where you find hope. Because it's
Yes.
no longer I'm broken, nothing's ever going to
Yes,
be able to fix me. Now it's okay, here are some tools. I
that's
have been
right.
empowered and educated to know that, one, I'm not crazy, so what I'm experiencing is valid, but also that there is hope and that other women, other people have healed from situations like mine. So I'm in the business of selling hope. I'm in the business of selling freedom. I'm in the business
Yes.
of freeing women from guilt and shame and physical pain. So I really, really love this work.
Yeah, I know. I can tell you're just, so passionate, and such a great practice you have. In my book, what happened was I felt broken for 30 years, and I had pain from the very first time I tried to have penetration when I was 17, and I was able to have it. We tried for 8 months. And finally things, we were able to, let's say, consummate the relationship. I went to see a doctor. She told me to have some red wine,
At
Doctor,
18,
this
you're like,
is
I'm not even old enough to drink, but thanks for that advice.
that's true. I wasn't. um, but then, for 30 years, I still had pain, and I didn't understand it whatsoever. And I didn't have didn't have strong desire, didn't understand pleasure at all. And then I had just gotten married, and I was looking online actually for just, something to help. Maybe, I don't know, a sex toy or something. I didn't know. I'd never experimented with any of those things because I just felt very, I don't know, unknowledgeable in that area. And I'd always been very intimidated by, all that, just like, here, just, put on a corset and whatnot. But anyway, I was looking online, and I saw by chance this diagnosis. Somebody was talking about vaginismus. And I burst out laughing because I'm like, what a stupid name. What a horrible name. Who would burden a woman with such an awful name for a disorder? And then, a minute later, tears running down my face, because I said, that's what I have. That's me. That describes the last 30 years. And it was so much, but so fantastic ultimately to bend my mind around that this brokenness that was associated with molestation, with this horrible trauma, the after effect of that I thought was just condemning me to like being a defective sexual person was a bunch of spazzy muscles. That's all it was like some spasms of my pelvic floor.
You just got a Charlie horse down below. It's just a headache in the pelvis.
And all of a sudden, it's just as you described, Jenna. It was like, oh, okay. Well, I can work on some muscles. I've been to physical therapy for a shoulder, for a knee, for a whatnot, right? I've been to physical therapy many times because all kinds of things, especially as you age, things get a little out of whack. And I'm like, I know this dealio, you just, you learn the exercises, you do the exercises, and lo and behold, you recondition the muscles. And I'm like, this is what it is. This is healing. This is healing. This healing is synonymous with empowerment, because it's finding what specifically is awry and how can I, have some structure for rehabilitation, and then, all the things that go along with that.
I love that you finding the words for your experience allowed you to feel validated of like, okay, I haven't been making it up. It's actually been hurting for 30 years. And like, now I have an understanding as to why. So here comes hope. So education is so important, and it's literally baked into my practice. And so her and Discover Her Health is healthcare education and resources. So it's not just enough to do healthcare, right? Like I said, I worked at a busy downtown clinic. You know, I could give a whole lot of hormones, give a whole lot of interventions that actually work. But what I didn't have is the time to really be able to educate clients about their own bodies, because that's where the empowerment piece comes from. It's
That's
from
right.
that client owning the information about themselves. And it's not just me doing something to you. Now it becomes, okay, the healthcare is done, the education I got, and then we move on to resources. So what are these things in the marketplace that could help me and I could use as tools to kind of move me along? And so that's really what the Her model is about, is we want to make it so that women are getting complete care and really being empowered to revolutionize their experience.
Yeah, and revolutionize their experience, and they have to customize their experience to a certain extent, because let's take vaginismus and dilator use. There can be high rates of non-compliance if it's just saying, well, go get some dilators, which are not necessarily the most pleasant thing, especially, you know, like the hard plastic ones. I know sometimes, you know, practitioners recommend those for like to hit different kinds of like pressure points and whatnot. But you know, but it's not necessarily the most erotic of of practices, but it can be married to things that are more erotic, or that help us rewire our erotic selves, if we have somebody like yourself, like your practice, to help us to figure out, how can I make this mine?
Mm-hmm.
How can I fit it into my day or my life, you know, because I need to do these exercises. How can I do this in a way that maybe involve my partner, right, that help us to reconnect, ways for me to really get more knowledge about my body and celebrate that, and fine tune my attunement to myself, to this part of my body which might have been numb for many years.
Mm-hmm.
You know, all of that, I think that then if I take ownership of this and I really make this even a pleasurable experience, then we don't have to worry about the non-compliance, because I'm fitting this into a larger context of I'm moving forward, I'm claiming or reclaiming my sexual self, and that is you know, a fantastic gift that I'm giving myself and the world, I would say.
Mm-hmm. And I like to say that, you know, when you are healed, when you are healthy, you can show up in the world and do what you're designed to do, right?
Yes.
I feel a calling on my life to do this work. If I did not feel well in my body physically, there's no way that I would be able to show up for my clients day after day in the way that I do. So once we are free from pain,
Mm-hmm.
that's when we can really show up and serve using our gifts.
Oh, absolutely. And then, you know, and even beyond, let's say, penetrative sex, there's all kinds of you know, there's all kinds of different parts of our being that are enhanced by a healthy pelvic floor,
Mm-hmm.
right? I know I started my career in the theater, and we used to all of us, we take singing lessons and dancing lessons. And I remember one actor I was working with, he said of his singing, he said his singing teacher used to always say, sing from your pee hole.
Mm-hmm.
Sing from your pee hole. That a strong voice comes from, right, that lift in the pelvic floor, that assist of the diaphragm to take in enough air.
Mm-hmm.
You know, and you know, grounding in the chakra system. There's all these things about the second chakra and the health of the second chakra, which is in the sacral area or the pelvic area, and how that assists with, right, being able to feel power in our being. The truth is, when we've got pain conditions or anything going on, let's say down there,
Mm-hmm.
right, that are undiagnosed, or that we're just feel like we can't solve, right, something we can't solve, I think a tendency is to just go numb in that area.
Mm-hmm. And it creates restriction, right?
Yes.
And if you are restricted in your pelvis, to your point, you're going to be restricted in your breath. You're going to be restricted
That's
in your
right.
voice because it's all so connected.
Connected.
And the
Restricted
pelvic
in your
floor is in
power.
charge of literally the most essential functions of being human, right? Birthing, breathing, pooping, peeing. You can't
Right.
be human without a pelvis that is properly functioning. Walking,
Right.
lifting, everything that it means to be a person walking God's earth, right? Like using our gifts, it is going to be connected with some sort of function in the pelvis. And so when we're
That's
talking about
right.
healing pelvic pain, we're talking about creating functional beings, creating human beings that are living up to their maximum capabilities.
So I so agree. And a lot of times when I'm teaching my courses, people will say, well, I've given up on sex. So why do anything to heal this painful condition? If I'm not going to have sex, what's the point? And I say, well, your pelvic floor is not functioning.
Mm-hmm.
You've got pelvic floor issues. So you do this because it's a part of your body that's not working, right? It's not working well. And then there are going to be all kinds of repercussions, right? With regard to everything. And the pelvic, all those pelvic floor muscles that are holding up all of those internal organs are just kind of, everything's above it. And it's just a sling that's like, holding things.
It's like at 17, you might have painful penetration, but at 77, you might start to have overactive bladder. You might start to have recurrent urinary tract infections. You might have incontinence. At 97, it is going to mean that your caretakers can no longer keep you in home because you have incontinence that is forcing them to have to change you and lift you. And that's a barrier to their ability to keep you in the home. So we're literally doing more than just saving sex lives. We're saving lives because grandma is falling on her way to the bathroom because she has to pee all night, right? Because she's suffering from something called nocturia, where you have to use the restroom all night. And when she's falling, she's breaking her hip. And that is devastating to someone's health, to elderly health. So it's not just about like making sure that we maintain this like sexy part of us. It is, like you said, this is essential, right? So we have to be able to pee and poop and do all these other things that are so essential to having a good lived experience.
That's right. That's right. And I'm so glad you mentioned all of that, because I think that sometimes gets lost. Gets lost in the conversation, when we do get very focused on, okay, let's solve this pain problem so that there can be some kind of penetration. But it is so beyond that. It is so beyond that. It's the health of our being. And I just love those examples that you use. I don't, I don't love the scenario, but I really am going to use those because I think we need to know that, right? That our health, our long-term health is dependent on this. Let me ask you, Jenna, about, not just, let's say, tight pelvic floor, but atrophy, because I get the same question about, well, let me just let the atrophy go. And because again, I have no libido, and I don't want to have penetrative sex. So just let it close up. So what?
Yeah. So atrophy is a term that is used when we talk about thinning of the skin, and specifically like vulvovaginal atrophy. It can create, of course, painful intercourse because you start to lose some of the architecture. So your labia, the lips, right? If we're thinking about pink lip syndrome, you start to actually lose that architecture. Those lips start to go away. And specifically in the opening, which is called the vestibule, the vulvovaginal vestibule, the urethra lives there. So if all of the tissue that is protecting the urethra starts to atrophy and thin away, then you're going to have more overactive bladder symptoms, more urinary incontinence, more UTIs, more vaginal infections, right? So atrophy is not just, again, we can't just center like we want a penis to be able to fit in here comfortably, right? Because then we're doing the same disservice that has gotten us into this, right? What we want is we want healthy vulvovaginal tissue. We want healthy urethras, healthy bladders, healthy bowel movements, right? So all of it is so connected. And so just letting something fall to the wayside is only going to bite you in the butt later. Because whether you have sex or not, you're still going to be at risk for urinary tract infections. You're still going to be at risk for urinary incontinence. Whether or not you address the issue is really up to you.
Yeah, yeah. Oh, fantastic. Thank you for that, because I think it's helpful for me, you know, when I'm talking to people, to be able to say, hey, you know, this, right, you're putting yourself at risk for these things, whether or not you want to have sex. And, you know, even if you don't want to put something in your vagina, a doctor needs to put a speculum in there for you to get a proper examination. And that is part of.
There are workarounds. Like, I've definitely done pap exams without a speculum. You know, there are things that we can do to kind of, in the meantime, in between time, get you the care that you need. So I also don't want people to think, well, okay, the speculum is the end all be all, and if I can't tolerate a speculum, then I'm not even going to see my provider, because there are still a lot of things that we can do. And I do something called a blind pap, where essentially I take that same broom looking thing that we would use, and I just kind of feel for the cervix and see if we can get a swab that way, if I'm not able to use a speculum. So there are other reasons to go to your provider besides just the speculum exam itself. And that's another thing that I think we put a lot of hype on is, okay, I got to be able to tolerate this speculum. And yes, that can definitely be a goal. But once you're able to tolerate it, if you're still not having pleasure, if you are still experiencing UTIs and incontinence and all these other things, then it means that there is more work to be done. It's not just that you are doing all of this work in physical therapy and breathing and hormones and all this stuff just to satisfy the check mark of, hey, I went to see my doctor and he was able to put a speculum inside of me. That's not
right. Yeah, that's not the right. I love that you say that, and thank you for the clarification in that, because it's I wasn't aware that you can do a PAP other ways, but it's also just, it's about the health of those tissues, and it's an understanding, I think, when it comes to something like atrophy, understanding genital urinary syndrome of menopause, understanding this new designation, you know, not so new, 9 years old now, but just understanding that what happens after menopause is not just what's going on in the vagina itself, but it's the whole, right? All of our vulvogenital tissues, all of our urethral apparatus, everything is affected by menopause, and everything's interrelated. Like you were saying, the vestibule is, you know, if you're going to have issues in the vestibule.
Right? It's not even just menopause. It's being postpartum. It is having PCOS, where you are having these irregular cycles and you're going months without ovulating and having a period, right? It is being on birth control, which naturally suppresses your natural production of hormones, so that you are kind of in a postmenopausal state as a 19-year-old, for instance, right?
Yes.
So it's not even just menopause, but menopause is, you know, in the news right now, and everybody's like starting to talk about it, which is really great. But there are lots of young women who might be listening to this podcast right now, and it's like, oh, this is, you know, an old person thing, right? For you were 17 when you first started to experience pain. And so some of that could have been hormonal. Who knows now, right? Maybe it was just muscular, but it's usually multifactorial. It's not just usually one thing. And so at any age, at any point along the spectrum, women deserve to have answers. And and
information. Like, I had a woman on my podcast who had vulvodynia. They couldn't figure out what was the cause of the vulvar pain. And what happened to her, she had it for maybe, 6 or 7 years. And then she decided, her and her husband decided to get pregnant, and she got pregnant and it went away. And when I had her on the podcast, no one had ever told her why it went away. And I said, well, were you on hormonal birth control before you tried to get pregnant? And she said, yes. I said, well, that could be, I can't say, of course, I'm not her doctor, but that's one reason that there can be pain. And I was really surprised that, you know, she went to all these different practitioners and no one made that connection for her. And I find that the young people that I work with, like on college campuses, etc., no doctor has ever told them that this is a risk factor for being on hormonal birth control, that there can be, right, there can be pain conditions, in lowering your hormones in this way. So it's information. I go back to your revolution that I am joining you on.
Yeah. It's so exciting. Well, this has been such a great time getting to know you more and just kind of sharing in our passion for educating, empowering, and healing women. It has truly been an honor to talk to you. And I'm sure that you will hear more from the two of us coming forward. So I just want to say thank you for joining us and helping us tame the taboo today.
Thank you, Jenna. It's been an absolute pleasure.
Yes. Have a good one. Thank you for tuning in to this episode of Tame the Taboo. If you enjoyed it, don't forget to hit like, share, and subscribe. Send this to your girlfriend so they can join you on your journey as we transition to our healthiest, wealthiest, best selves. See you in the next episode.